Good day, everyone. Today we will have our health awareness workshop on monkeypox, the current facts and preventive strategies. Monkeypox is a critical public health concern due to its risk of transmission through close contact and the possibility of causing a severe disease. After this short lecture, we hope we can impart to our dear students and faculty significant awareness of monkeypox. Monkeypox is a viral zoonotic disease that is caused by monkeypox virus, a member of the orthopox virus genus in the Paxviridae family related to smallpox. It is a double-stranded DNA virus that was first identified in 1958 in crab-eating macaque monkeys in Denmark. In 2022, the WHO renamed it as Mpox to reduce the stigma and clarify that monkeys are not the primary reservoir. There are two distinct clades or types of Mpox: the clade 1 or the Congo Basin or Central African with subclades 1A and 1B, and the clade 2 or West African clade with subclades 2A and 2B. It is believed that clade 1 causes the outbreaks in Central and Eastern Africa, and the clade 2 continues to spread at low levels in many countries around the world and has been the reason for the rise in epidemics since 2022. The natural reservoir is not definitely identified for Mpox, but it is believed to be in small mammals like rodents in Central and West African tropical forests. There are species like rope squirrels, tree squirrels, Gambian pouch rats, and dormice that are suspected hosts based on serological evidence and virus isolation studies. Non human primates, including monkeys, can contract and transmit the virus but are not primary reservoir.
Good day, everyone. I am Dr. Herrera, and for the next few minutes, I'll be sharing an overview of the current trends and data on monkeypox. The monkeypox virus was discovered in Denmark in 1958 from monkeys kept for research. The first reported human case of mpox was a 9-month-old boy in the Republic of Congo dated 1970. In 2003, an outbreak in the United States of America was linked to imported wild animals. And then, on 2017, mpox re-emerged in Nigeria and continues to spread between people across the country and in travelers to other destinations. In May 2022, an outbreak of mpox appeared suddenly and spread across Europe, the Americas, and then all six WHO regions. A new strain of the virus called clade 1B is causing outbreaks in previously unaffected areas of the country and has spread to countries that had not previously reported mpox. Recently, according to the WHO, over 120 countries have reported mpox between January 2022 to August 2024, with over 100,000 laboratory confirmed reported cases and over 220 deaths among confirmed cases. Globally, cases of mpox peaked in August 2022. In March 2025, a total of 50 countries outside Africa reported 4,169 new confirmed cases and 25 new deaths. In Southeast Asia, the highest number of cases occurred in April and May 2024, with over 20 cases each month. After a significant drop in June 2024, the number of cases fluctuated, showing a general decline over time. Philippines, mpox cases began rising significantly in August 2024, peaking in December 2024. After the peak, cases declined in January 2025, with a further drop in February 2025. Deaths were first recorded in November 2024, and a decline is seen in January and February 2025.
Now let us move on to the transmission. How do you get monkeypox? It is through direct contact with skin lesions, bodily fluids, and respiratory secretions of the infected individuals. This is again direct contact. Indirect contact would include the person uh, touching contaminated objects, fabrics, and surfaces that were previously held by the person infected with monkeypox. Another mode of transmission is during pregnancy. The mother can actually spread the virus to her fetus through the placenta. But what happens if you do get infected with the monkeypox virus? There will be an incubation period, about 7 to 21 days, and this is when the virus is inside your body, and it multiplies, the replication of the virus, and then it spreads to the lymph nodes, and then it will later on spread to distant lymph nodes and the lymphoid organs, and then there will be even more replication occurring in that location. Then during the prodromal phase, it then transfers or goes to target organs like the skin, the lungs, the gastrointestinal tract, and then this will eventually lead to the appearance of the clinical signs and symptoms of the monkeypox infection. During the incubation period, a person is not contagious during this time, but during the prodromal phase, a person may be contagious during this period. A person is still contagious until after all the scabs of the skin have fallen off and a fresh layer of intact skin has formed underneath. But what is important about this prodromal phase? It is the time the patient who is infected with monkeypox is actually contagious. So, if a person presents with these prodromal phase, that we have to instruct the patient to isolate if they develop symptoms. Okay, because a person with monkeypox infection may develop an early onset of symptoms. It includes fever, malaise, headache, sore throat, in many cases swollen lymph nodes in other parts of the body. Okay, lymphadenopathy is a characteristic feature of monkeypox, and the lymph nodes may swell in the neck, okay, the armpits, the inguinal areas, and even occur on both sides of the body.
For the clinical manifestation of monkeypox, the rash may be located on the hands, feet, chest, face, or mouth, or near the genitals. Other signs and symptoms include fever, chills, swollen lymph nodes, exhaustion, muscle aches or backache, headache, respiratory symptoms such as sore throat, nasal congestion, or cough. Typically, monkeypox symptoms start within 21 days of exposure to the virus. If you have a flu-like symptoms, you will likely develop a rash 1 to 4 days later. This slide shows the evolution of the skin lesions, which start as macules and progress over weeks until they heal and new skin forms. Lesions typically begin as flat discolorations called the macule, then later after 1 to 2 days become slightly raised and firm, which is called a papule. In another 1 to 2 days, the lesions fill with clear liquids called vesicles. Then the next 5 to 7 days, the lesions fill with opaque yellowish fluid, which is called the pustule. Once the rash resolves, lesions become crusty scabs that itch, which lasts for 7 to 14 days. Once all scabs have fallen off and a fresh layer of skin has formed, a person is no longer contagious. These are more sample pictures of the rash of monkeypox. Lesions are firm or rubbery, well circumscribed, deep-seated, and often develop umbilication. This resembles a dot on top of the lesion. They typically develop simultaneously and evolve together on any given part of the body. Lesions are often described as painful until the healing phase when they become itchy and become crusts.
As for the management of monkeypox, there is no specific treatment for this disease because most will recover within 2 to 4 weeks without the need for medical treatment. The goals for management are to take care of the rash, manage the pain, and prevent complications. The most important thing is to try not to spread the rash to other parts of the body, spread the virus to others, and possibly cause open lesions to become infected by bacteria. To keep this from happening, do not touch or scratch the rash. Do not pop lesions from the rash. This doesn't speed up recovery. Do not shave areas with a rash until the scabs have fallen off and a new layer of skin has formed. What we should do is wear a mask and cover the lesions when around with other people, and of course, wash our hands with soap and water. To manage the pain, patients with Mpox may take pain relievers such as ibuprofen and paracetamol. But if the pain becomes severe, seeking help from a healthcare professional is advised. A vaccine is available to prevent Mpox. This is given in 2 doses, 4 weeks apart. The vaccine is also recommended for people who are close contacts or have been exposed to another person with Mpox. This vaccine should be given ideally within 4 days. If you think you might be sick with Mpox, contact your healthcare provider for advice. To prevent spreading the infection to other people, stay at home in your own, well-ventilated room, wash hands with soap and water, wear a mask, avoid touching items in shared spaces, avoid close skin-to-skin contact, and disinfect shared spaces frequently. Here are our references. So, as we conclude today's lecture on monkeypox, let's remember that staying informed and vigilant is key in managing emerging infectious diseases. Thank you for your kind attention.